Anthony Topazzi knows all about beating the odds. Following Hurricane Katrina as president of Mississippi Power Company, he got the lights back on in a jaw-dropping 12 days.
We did the impossible.
But an even bigger challenge came a short time later when he was diagnosed with ALS.
There is no hope.
He could hardly swallow. Soon he wouldn't even be able to breathe.
I went through a period of depression, no question about that. But then I decided I had to do something about it. And I went on a relentless search for anything I could find that might help me.
He came across a little-known treatment called the Deanna Protocol.
Just by the grace of God.
He gave it a try, hoping to slow down his body's deterioration, and was amazed when it actually reversed his symptoms.
6 months ago, I had a problem with excess saliva. I don't have that problem today. My voice is better than it was. It's not perfect, but it's better than it was. I couldn't drink water or take a pill without feeling like I was going to choke to death. Today I'm taking probably 30 pills a day. I don't even think about it. I could only eat soft food 6 months ago. I'm eating steak, ribs, anything I want today.
The Deanna Protocol is relatively unheard of because one doctor created it at home for one patient, his daughter Deanna. 5 years ago, she was enjoying life as a new bride and a young attorney when her doctor said she didn't have long to live.
And he said, "You have ALS." And at that moment, I felt like I left my body.
We took her to all the various citadels that specialize in ALS. And to my chagrin, there was nothing that could be done for her.
Not willing to accept defeat, Dr. Tadone left his job as a surgeon and, after years of trial and error, developed a treatment that stopped the progression of Deanna's ALS.
I call myself the resident guinea pig.
The main ingredient is the energy-boosting AKG.
So we put her on the AKG, and then we ran out of it. Within one day, her tremors became unbelievable. Okay. Put her back on it, got some more, put her back on it, the tremors subsided.
The Deanna Protocol requires working the muscles with cardio and weightlifting, then massaging them with coconut oil. Although testimonials like these are encouraging, they're not enough for most doctors to recommend the Deanna Protocol to their ALS patients. Many doctors consider anecdotal evidence unreliable and will only recommend a treatment to their patients that's been scientifically researched. That research is now underway on the Deanna Protocol. Scientists at the University of South Florida are studying its effects on mice with ALS.
We're using an ALS, a mouse model of ALS that is considered by most ALS researchers as kind of the gold standard, in that the pathology in the ALS mice is very similar to the pathology in humans.
If the Deanna Protocol slows ALS in lab mice, that could lead doctors to recommend it to their human patients.
I have a strong faith. Things happen for a reason. Just maybe I got this so my dad would get involved, and this would eventually lead to a treatment that would save people's lives until a cure was found.
Lori Johnson, CBN News.